My name is Louise Carlsen and I'm a medical doctor at the Danish Headache Center. In this video, I will talk about treatment of medication overuse headache. First, I'd like to state that the best treatment of medication overuse headache is prevention. This can be done with focus on patient education, information about correct and effective use of analgesics and migraine medication, and the risk of medication overuse headache. Initiation of effective pharmacological and non-pharmacological treatment of the pre-existing headache. We should also pay special attention when we, as healthcare professionals, treat comorbid pain with analgesics. Now, let's talk about how we can manage patients who already developed medication overuse headache. And let me introduce Sarah. Sarah is a 45-year-old woman working as teacher in elementary school. The last 2 years, she has been on sick leave at least 3 days a month because of severe, non-treatable migraine attacks. Headache occurs almost every day, and she has migraine on approximately 12 days a month. At least 25 days a month, she takes ibuprofen and 12 days with triptans. This pattern has continued for at least a year. A normal neurological examination and a normal MR brain scan are performed. The conclusion is that Sarah fulfills the diagnostic criteria for chronic migraine and the criteria for medication overuse headache, with 2 subtypes: medication overuse headache caused by simple analgesics and medication overuse headache caused by triptans. So, how can we help her? Treatment of medication overuse headache is one of the debated topics in the headache field nowadays. But a treatment strategy that can be recommended is withdrawal of the medication overuse combined with early start of preventive medication. The preventive treatment should target the pre-existing headache. If the pre-existing headache diagnosis is too unclear, the start of preventives may be delayed to after withdrawal. This treatment strategy with withdrawal and preventive treatment has proven effective in several studies. Headache days per month are reduced approximately by 50%, and about 70% of patients revert to episodic headache. Also, disability is decreased and quality of life is increased. We now know from a randomized controlled trial that complete stop of all painkillers for a 2-month period is the most effective and feasible form of withdrawal. Some places even recommend a 3-month period of withdrawal. The most important issue of the withdrawal is to prepare the patients for the withdrawal. That means a detailed information about the nature of medication overuse headache and the reasons for withdrawing the medication overuse. Detailed information about the withdrawal procedure and withdrawal symptoms. Patients may experience transient worsening in headache, nausea, vomiting, anxiety, restlessness, heart beating, hypotension, and sleep disturbances. Withdrawal symptoms can be relieved by rescue medication, but there's no international consensus of rescue medication, and many substances have been suggested. Prednisone, sedative drugs, antiemetics, non-steroidal anti-inflammatory drugs, and so on. More research is needed. The headache and the withdrawal symptoms will decline over the first 2 to 3 weeks. If possible, patients should consider sick leave in these weeks. Specialized care should be considered if patients are overusing opioids, barbiturates, benzodiazepines, or if they have significant comorbidities, for example, psychiatric disorders or other pain conditions, or if they previously have failed withdrawal. Some studies have identified that depression, high frequency of headache, and tension type headache are risk factors for a more poor treatment outcome. So we need to be more aware and take more care of this group of patients. For our patient, Sarah, withdrawal can take place in the primary or secondary care and as outpatient care. When Sarah has succeeded withdrawal for 2 months, the next important thing is to prevent relapse. So we tell her to keep filling out a headache calendar. We prescribe her some effective acute medication and advise her to use it maximum 9 days a month. And then we check up on the preventive treatment. We follow her closely for the next year. So, to sum up, prevention of the development of medication overuse headache is number 1. If patients already have developed medication overuse headache, then start withdrawal therapy and find an effective preventive treatment for the pre-existing headache. And then, finally, prevent the relapse. Thank you very much for your attention.